Welcome to My Body, My Bump, My Baby, where we help women be empowered, intentional mothers. This podcast is best enjoyed sipping tea or taking a stroll in nature. This podcast is for informational purposes only and should not be substituted for professional psychological or medical advice, diagnoses, or treatment. Always seek the advice of your physician, midwife, or other qualified health provider with any questions about your personal situation, health, or medical condition. Welcome to another episode of My Body, My Bump, My Baby. Today you have B, which is me, and our very special guest, Justine Calderwood, who is a physical therapist with the Healing Spot Physical Therapy. Justine is a very special kind of physical therapist. She focuses on women's health PT, and today we're going to dive into pain with sex after baby is born. Hi, Justine. How are you?
Good. How are you doing, B?
I am good. I'm so excited that we finally got you here. Justine, tell the listeners a little bit about you and your practice.
First off, I just want to say thank you for having me on the podcast. I'm really excited to be here. Yes, as you said, I have kind of a specialty practice. I treat a lot of pregnant and postpartum moms, and we do a lot of pelvic floor physical therapy. So it's just a little different than normal physical therapy because of the specialty that we have and because of the issues that we treat.
What are some of the, just like to give us an idea of the scope, what are some of the common issues? Because for me, when I hear PT, I always think, oh yeah, that's where you go to recover after like knee surgery or foot surgery or something like that. And you're really focusing on pelvic floor and women primarily. So what kind of issues can come up in that realm?
So we always say when it comes to the pelvic floor, it's going to have the functions of pee, poop, and sex, basically.
Poop, and sex.
So anything related to that. So changes in bladder functions. So that can be feeling like you have to go all of the time, or feeling like there's leaking, or
the little bit of pee when you sneeze or when you cough or when you laugh too hard.
Yeah, working out, things like that. Yes. So
gotcha.
It's super embarrassing. And that can happen for several reasons, and it isn't just related to age. And then issues related to bowel function. So it might be, again, leaking of the bowels. It might even be incontinence, but also things like constipation or irritable bowel syndrome, things like that.
Oh, wow.
Yeah.
That's super interesting. So constipation can be related to the pelvic floor.
Yes, absolutely.
I never knew that. That's interesting. Yeah. Always learning something new here.
Yeah. And then, of course, with sexual function. So there might be pain with intercourse, or for some women, they have a hard time orgasming. They also maybe have changes in sensation because of the nerve function down into the pelvic area, into the genitalia. So pretty much related, pee, poop, and sex.
Pee, poop, and sex. I love it. Well, those are all very important, I feel like. Mm-hmm. And sex is very important. And we kind of wanted to chat today about, you have your baby and it's fantastic and wonderful and you love this little person. And after some time passes, maybe 6 weeks, maybe 12 weeks, the partner wants you to start to get back to normal life, or maybe you want to get back to your intimate part of your relationship with your partner. But sometimes for some women that can be difficult or a challenge. What are some of the common complaints that you're seeing in your practice related to pain with sex after baby?
Yeah, a lot of the common complaints that we hear is just pain with, say, initial penetration. And they'll say, if I know that I had a small tear, or maybe they had a larger tear, and they'll say, maybe things aren't healed. But if it's been past that 6 to 12 weeks, things should be healed down there. So we see people even months later, or sometimes even years later that
say, oh my gosh,
I'm having pain and this happened after I had my baby. Maybe things didn't heal. And it's not really a matter of necessarily that wound or that tear is still open. It's just, we can go into that a little bit more. So we hear that a lot, either pain with initial penetration, sometimes with deeper thrusting. So it might not be right at the vaginal opening, but deeper in.
Okay.
More like what you'd think like into the back wall of the vaginal space. So maybe
closer to the cervix, if your cervix is high, maybe. Is that kind of where you're...
Yep. And even sometimes people might feel it more like into the tailbone, or they feel like a fullness in their rectum, something like that, even with vaginal penetration. They'll say things like that. Or it might even be positional. They'll say, it just depends on certain positions. I don't know what's going on. I don't know if my cervix is in the way or my uterus is fallen down. They'll say it seems to be more positional versus that it's every single time.
You know what, Justine? Right when you're talking about like somebody coming and talking about like positions and depth, I'm going to say, do you find like, clearly you're busy, but holy cow, that's a tough conversation to have. And I feel like most ladies would rather just like, hide behind a little rock and act like nothing is going on rather than to seek professional help and actually have these conversations. Do you have people who come to you who have been like, hey, I've had this problem for so long, but I just like, maybe one, they didn't know,
Yeah,
they didn't know,
help.
right?
Yeah.
Or two, maybe they were just embarrassed, or maybe thought maybe they were just some special, unique case in the world.
Yeah, absolutely. Or they're held back because, how do you talk to your medical provider about that? How do you get the help? And luckily, people can Google and find us. But absolutely, I kind of joke with people when I talk to them on the phone, the very first conversation. I mean, I'll say, look, I know I just met you 30 seconds ago, but I'm going to ask you a lot of intimate, personal questions. Just let me know if there's anything that you don't want to answer. And, I never get anybody that says, wait, hold on. Most people are like, when they seek out help, they'll say,
they're ready.
Yeah, I'm ready. I know, like, this is part of it. And we really try to create that confidential and safe space for people to share their stories with us.
Wow. Okay. I'm so glad to have you here because I think that this is probably something that a lot more women are struggling with and are not seeking help. And hopefully they'll hear this and realize that there are people out there that can help and that are trained and skilled and also can kind of approach it in a way that doesn't feel too intimidating. So some other things that come up in your practice?
So sometimes people just say, they're kind of in that cycle of, hey, this hurts, and therefore, or it's not maybe hurting all the time, but it happens often enough where they get scared that it's going to hurt this time. And so there's kind of this pain cycle and worry and fear over things where it should be a very pleasurable activity, right?
You should look forward to it. And so if you're like, maybe one time you had pain, a couple times you didn't, but then next time you have pain, then I can see you kind of just wanting to like, I don't know, just it's not worth it. Just want to avoid this situation, right?
Yeah. But typically when people will reach out when it starts to affect their relationship, where they'll say, okay, this used to be a very important part of my relationship with my spouse, and therefore now we're not able to connect in that way. And then also, you get women that are afraid that if they can't have sex, they're broken, or maybe their partner's going to stray, things like that. So we know that underlying, even if people don't say that can be some of the fear that's involved.
Plus, if they just had a new baby, I feel like so much has already changed in the home and the relationship, and then to add the intimate part of the relationship in that's got to be a struggle for sure.
Right, absolutely. And then we also get just people that ask about their past trauma. Maybe they've had some sexual trauma or even physical, emotional trauma, and they'll ask like, could this have something to do with what's happened in the past? I'm in a very loving, safe relationship, but something has changed between prior to having baby and now. And we do see that can come into play where, we have a baby passing through that birth canal into the pelvic space, where some women prior to birth have been maybe a little disconnected, as a way of protecting themselves and kind of dealing with the situation, so to speak. But now we've had a change.
It's like maybe like the baby, pushing the baby through the vaginal canal is unearthing some buried trauma. Yes. And now it needs to kind of be dealt with because here it is, right? It's kind of rearing its head. Yeah.
But I also, on that note, I also see women that tell me the opposite of saying, wow, I had all of this like buried trauma, and actually having my baby seems to have helped that. I think it actually brings them kind of down into a space that didn't feel safe, and now they have this beautiful child that they're, that they have welcomed into the world, and now it's kind of their opportunity to do things better for their child in that they weren't maybe given in their life. So
I love
kind
that.
of going deeper there, but
I love that. Yeah. Well, one of the things we talk about on the podcast often is, when a woman is giving birth or a woman is laboring, that she has to kind of peel back a layer of her skin a little bit, lose a little bit of herself. And the idea is that, yes, there's being a baby born, but also there is this new woman who is now a mother, either first-time mother, second-time mother, but it's an evolution. And in that evolution, maybe you can kind of like ditch some of those past things that just were not working for you as you build into this new person that you are. I love that.
Yeah, it's beautiful. So, that kind of sums up a lot of what we hear, I guess.
So going back to that the first thing you mentioned was initial penetration. What could cause that? Had the baby, are healed if there was any damage, are healed, but still having pain at that initial penetration. What could cause that?
So it could be that tear is healed, but now there's scar tissue. And so scar tissue it's not as elastic, it's not as stretchy as the tissue that was there. And so, and scars can even kind of send signals back to the brain of, even though it's stretching, it can like almost be hypersensitive where, it's sending more signals to the brain and to that area of pain. So we can work with those scars, but we first have to know that that's kind of what's going on and to assess that. But scars can happen, or tears can happen into the perineal area, even up into the labia and the pelvic floor muscles. The entrance there is pelvic floor muscles. Can also happen a little deeper or down towards the rectum. That space between the vaginal opening and the rectal opening, those tears can go all the way down. And that's going back to why that can affect some of the bowel function too.
Oh, of course. That makes a lot of sense.
Yep.
And if there is a listener out there who is kind of listening to this and thinking, I wonder if that's what's going on with me. What kind of sensations are people typically describing when they're saying, that initial penetration is painful or uncomfortable? What is it typically, or is there one kind of typical description, or maybe there's several? I don't know.
Yeah, I hear a lot like a searing, like white hot pain, or even like it feels like it's ripping all over again. Ooh. There may be other ways to describe that, but I would say those are probably the two that I hear the most.
Yeah.
Just like that sharp, like something's tearing.
Oof.
You can imagine how painful that must be.
Heck yeah. Oh my gosh.
Yep.
Wow.
And with the scars, I want to mention too that even if you didn't have a vaginal birth, excuse me, even if you didn't have a vaginal birth, if you had a C-section birth, that can still impact pelvic floor. And people can be quite surprised about that. But, if you think about a baby being, coming out from the top, well, pelvic floor is still involved with that. It's kind of like, think of it like a balloon, right?
Okay.
So it's round, and we got the bottom of the pelvic floor, and then the top, the womb there. But that can happen because C-sections, but also in the scarring of C-sections, can kind of work its way down into that area. Yeah.
Oh, wow.
Going a little off subject, but that's also what we find with C-section scars is typically they're horizontal, right above that pubic bone.
Right.
And think about right underneath there is bladder and uterus, not too far in rectum. And so those scars, I describe it to my patients almost like a weed. If you ever have found a weed and you were going to throw, pull it out of the ground and you thought this is going to be easy, and you come to realize that it's got this extensive root system.
I guess that makes sense if you think about it, because they're going through the skin layer, but eventually they do get to the uterine layer, but the uterus at that time is like big and inflated, and then it goes down. And as it goes down, that scar tissue is going to start to move down and change. And so even a woman who has had a cesarean birth could experience pain after sex due to birth.
Yes.
Wow.
Mm-hmm. Yep.
Okay.
Yeah.
I had no idea. I'm guessing there's a lot of women who wouldn't put those two together because they're like, well, the baby didn't come out of my vagina, so why would it be hurting, right?
Mm-hmm. Yeah,
wow.
Absolutely. And there can even be micro tears that occur into that, the vaginal tissues, even if you didn't need stitches. I hear that a lot. Like my midwife or my OB said that I didn't even need any stitches. It was just maybe they knew that there was a small tear, or sometimes I suspect there's even micro tearing that we're not necessarily aware of, but that's affecting things.
That makes sense, because if we think about when we're talking about tearing for a vaginal birth, we're talking about parts of the vagina that you can see with your eyes. But that doesn't include all of the pelvic floor that the baby's head just put pressure on and was stretching out and bulging. There's a lot of that we literally cannot see with our eyes when we're doing a vaginal exam right after the baby is born. And you're saying that there's a possibility, just like with any muscle, you stretch it too far, there can be these little micro tears that, in the other parts of our body that we wouldn't be able to see. And in this part of your body, you wouldn't be able to see. We only can see that vaginal area, and that's it.
Mm-hmm.
Yeah.
Yes, absolutely.
So, Justine, earlier you mentioned birth trauma could play a part in this. And this is going to sound like a silly question, but how would you know? I feel like some people remember these things and some people don't.
Right. Absolutely. Yeah. There's women out there that know they've had trauma. I mean, just asking them about their birth can make them emotional, and thinking about it can make them emotional. And, they know without a doubt, yes, that was a traumatic birth. There's a lot of other women out there that have had birth trauma and don't really know that they don't have anything to compare it to. Maybe they're first-time moms, or they just thought that was the way it is, right? So some of the signs or some of the things that I have learned with birth trauma is that it's kind of like that feeling unheard. Women that feel like, I had a birth plan, it wasn't followed. My birth professionals didn't listen to me. They went ahead. I've had people tell me they've had an episiotomy when they specifically said they didn't want one, and the doctor did it anyway. So that's kind of an example. Or, not being respected in the birth process. I guess wishes and desires not being listened to. And I know that there's a time and a place for that, for sure. But even for somebody that ends up needing some emergency type interventions, there can be, a way to help with that process. But things not going as planned, or
maybe even things not going as expected or anticipated. Maybe you don't plan it. Maybe you're just like, well, I'm just going to go and I'm going to have the baby. But in your mind, you're like, and it's going to be pretty calm and mellow and not a big deal. And then they get there and it ends up being this completely different thing. And they feel like, what the heck just happened to me, right? Like I just got ran over by a bus. But then you come out of it and you're like, well, nobody else says that. So this must be normal.
Right.
And okay.
Yeah. And I mean, not that everybody can plan what's going to go
right.
on, but yeah, like you said, unexpected and then not maybe knowing how to process that. And
right.
everybody has, like for one person that might be just fine how those events took hold, and other people may not. It's all about the processing, right?
Right.
And the perception. Let's see, events feeling like they sped up. Like when I talk to some of my moms, they'll tell me like there's a period of time where it just felt like time, like it was a 2-hour span, but it felt like 5 minutes. Like they kind of lose track of time.
Right.
It just feels like things are out of control, and it was moving so fast. That's a sign of possible, some birth trauma there. Yeah.
So what you're talking about, when I'm listening to you, I'm hearing emotional body. And I feel like when I'm thinking about PT, I think physical body. Mm-hmm. But we've kind of skipped over into a different realm, haven't we?
Oh, yeah.
Yeah. So tell me about that. How does that work?
That's really interesting. And I think I can't speak for all pelvic floor PTs, and I can't speak, for them. But my training specifically, I've do a lot of mind-body type interaction, because from what I've learned, you cannot separate that out.
Right.
So when we start doing body work and we get our hands on people, stories start coming up, emotions, memories, even beliefs, belief systems or beliefs about a lot of things. I mean, we could do a whole other long podcast on just stories and stuff, but there is a fine line. I mean, I do respect mental health providers and know my lane, but the thing is what I have found when we start getting into those tissues where that's held, it starts to come up. And so being able to guide my patients through that and hold space and keep them safe, and knowing where they need some more professional help versus where they just need somebody to honor what they've experienced and let them process and let them cry if they need to, and just hear, you're safe.
Wow.
I'm here with you right now, and helping them through that.
Does a birth trauma session, is it kind of like a combination of, it almost sounds very holistic in my mind. So like a combination of maybe there is some touch, but there also is some emotional release and maybe even just a little bit down to the soul level kind of like release or processing or maybe even closure on things. Is that fair? Is
Absolutely.
that right?
Yeah. And there's times where I will support someone's body, and I might be releasing something like the kidneys, and it sounds kind of funny, like how does a physical therapist release the kidneys? But the kidneys can store a lot of that stress response. And so just doing a little bit of visceral manipulation, just kind of holding those kidneys and I can feel it's a quality of energy release, quite honestly, that I feel with my hands. And sometimes I'm guiding my patients through, say, a meditation. I love Tammy Lynn Kent. I don't know if you know her work.
I haven't heard of her.
She's a holistic physical therapist, and she's written a few books. One is Wild Feminine, and the other is Mothering from Your Center. And I believe it's from Mothering from Your Center, a couple of her meditations that I've learned in my training. And it's restoring that birth flow and just helping. It's just something I read, quite honestly, but it really can help with some of that trauma that's there. And
so maybe like some stored energy, is that kind of what you're expressing?
Yes.
Like something that is stuck and it's just not able to move, and you're kind of helping this move.
Yes.
And start to flow again.
Yep. Absolutely. Yeah. So that's just one example, with the birth trauma. And there's times where I don't know that's going to come up, until I get my hands on and build that trust with my patients, and then they'll start telling me about, it might be birth, it might even be other types of trauma.
Right. One of the things that I was curious about was maybe sexual trauma, and specifically childhood sexual trauma. And I think that in that case of childhood sexual trauma, we're still in that same area where maybe we know about it, but maybe also we don't remember it. It's kind of been blocked for protection purposes. Is that something that you work with as well?
Yes, absolutely. That comes up a lot, actually.
Yeah, I can.
Yeah, layers of healing for women that I've been working with. Yeah.
So really, this is just coming to my mind right now because I feel like anytime we're working with trauma, it's not a simple thing. So this has got to be like multiple session kind of therapy that we're doing here. Is that right? It's not like, one shot, like very Western medicine, go take a pill and then you're done.
It's a process. And again, our number one when we establish care with somebody is to just build that rapport, that trust, that safe space, because this is an unfolding of events. I mean, I have seen a few people, to be honest, that it's kind of like very cut and dry as far as pain with sex after having a baby. Like they'll come in for a few sessions and we wrap up. But and I'm not saying everybody that has pain with sex has had a previous trauma and they might have repressed it. I want the listeners to know that just, that doesn't necessarily mean you've had trauma in the past. But yeah, it's usually an unfolding of events and processing through that. Mm-hmm.
How many, just to give, I don't know if this is even a fair question, but like these are some of the questions that are coming to my head if I'm like, well, if I'm thinking about doing this is like on average, how many sessions should a person expect? Like, what is the appropriate expectation in this kind of process? Or maybe not even sessions, but maybe timing. Because for me, if I have a new baby, that's a lot already. Then I'm having relationship problem maybe because of the intimacy that's causing me stress and it's causing my partner stress. And I'm just like, I just want it to be better. Like, just fix it. Like, what is a good... If you were to tell somebody this is appropriate expectation for this therapy, how much time is that typically? Yeah,
that's a really good question. And I can tell you based on, I keep track of this over the years of like how many sessions we have seen people for. And I'm lumping everybody together when I'm going to answer this because it's not just people that have had pain with sex after having a baby, but average number of sessions that our patients see us is around 9. To be honest, 8 or 9.
And then over what kind of period of time do those 9 sessions occur?
That's a really good question. So we oftentimes start out at weekly when we start seeing our patients, and we might see them for 4 to 6 sessions weekly, and then we try to build a little time in between.
Okay.
Now, some people are going to need more sessions than that, and some may need a few less. Yeah, but we really always tailor it to how quickly is somebody progressing through, and some people take a little longer because they're not able to find the time to do some of the self-care things at home, or not being accountable for that. But if somebody comes in and they're ready to heal, then we can help them through that. Now, some other people, I always tell them, let us know. Please communicate to us, because some people we realize, they need a little bit of extra time. We need to slow them down purposefully so they have time in between those sessions to process and to work through things. And that's fine too. We always tailor it to the needs of our patients.
Oh, that makes a lot of sense. Justine, so within the realm of pain with sex after having a baby, are there any other things that we haven't talked about yet that may be causing the issue?
Yeah, so we often see women that are in what I call an open birth pattern. That's actually something I learned through the Institute for Birth Healing. And it's really the movement that the pelvic bones go through in order for baby to come out and have that vaginal birth, right? And even, again, going back to the C-section births. So depending on how far baby got down into that birth canal, these changes can happen. And regardless of whether baby was born C-section or vaginally, body can still be in what's called an open birth pattern, where instead of being like closed back down, things are still kind of open. So I know I'm using my hands right now to kind of like show, but imagine sits bones. If you're sitting right now, those bones being able to kind of open like a flower, so to
Yes.
speak, right? And the tailbone moving backwards, so we're widening that space in order to have that vaginal birth. Well, imagine if there has been a little bit of birth trauma, or just for whatever reason, the body can get kind of stuck like that from labor positions, and I won't go into all of it, but so the body being kind of like open still. And so energetically speaking, we kind of had this flow outward. And also physically speaking, imagine that the muscles that go between the sits bones and the vaginal space are pulled taut, like all day long, consistently. And so, when we go to do something like sex where things need to stretch even more, well, those tissues are already on a stretch.
Yeah.
So the open birth pattern is something I've learned through Lynn Schulte for the Institute for Birth Healing, is about closing that back down and getting the bones, the pelvic bones, to move in the way that they need to. So it's very gentle, but we try to close that back down so those tissues aren't on a stretch all the time.
So that sounds like it would be like maybe a gentle hand manipulation of the physical body then. Is that right?
Yes.
Yeah. Very interesting.
Yeah.
By the way, ladies, I've never actually heard of open birth pattern from this perspective, but there also is an energetic open birth pattern where people just are very open during their birth, and while they're very energetically and emotionally and spiritually open, little things land in very deep, and then we're kind of stuck with them and have to like work it out and process those. So it makes a lot of sense. Any part of the body can kind of get caught up in that, especially with such a big experience.
Yeah, that's actually where Tammy Lynn Kent, that's why she has this meditation, because what she says from her, I think we're on the same page there. Just
really?
It kind of opens up the woman's like field opens up
yes.
to the whole room. Right?
Yes.
So anybody that's in that space with her, she's feeling
very
that and aware
vulnerable,
of that,
yeah.
and not even aware of it, right?
Right.
So she may be holding things, not knowing she's holding it for other people,
right,
in their experience.
Yeah, that's crazy. Are there other things that may cause this? Is it only having a baby, or are there things like outside of birth that could cause pain during sex? Maybe you didn't have a baby, but you have pain during sex. Is that a thing?
Oh, yeah, absolutely.
Yeah? Okay.
Yeah. No, I know when we had talked that we were talking, like, your audience is primarily, pre-pregnancy, pregnancy, postpartum. But absolutely, we see women and that do have... We see women that do have pain with sex that haven't had babies. Yeah. Some of the reasons are still there, some of the trauma. But also what I didn't mention so far is even just sports injuries. It doesn't have to be this like super like traumatic thing. It could be falls. It can be, like fall on the ice or snowboarding, skating, that kind of thing.
Childhood injury on the playground.
Yeah, normal everyday things that we get those bumps and bruises, and they don't have long-lasting effects because they're not causing a severe, like, back pain or things like that. But those injuries can come back in later on because of the tightening of the pelvic tissues, of the hips, the glutes. I mean, there's so much musculature in anatomy. It doesn't have to necessarily be internal.
Yeah.
That's kind of like the camel, or the what is it?
The straw that broke the camel's back.
The straw that broke the camel's back. That might be the area that you're having the most pain, but it's not necessarily just the cause of it is right there. It could be related to other things.
So this is really good to know, though, because maybe you have had an issue like this all of your life. You don't know why. We're talking about this occurring after a birth, but you're like, I haven't even had a baby yet, and I've been dealing with this forever, and I don't know why. It absolutely is valid, but it could be because of a past injury, and it is treatable. Is that right?
Yes, absolutely.
It's treatable, so you don't have to deal with the pain forever. You can seek help and hopefully resolve that and feel better.
Yes, absolutely. And I will say too, there are some women that think, okay, well, say they have some tightness and maybe pain with, they had pain with sex prior to having a baby, and they think, okay, now after I have a baby, everything's going to be stretched out and my pain's actually going to go away. And that's not even true either.
Oh, wow.
Yeah, so that's not true. We do find that, we can treat all of it, but it's not necessarily going to make it go away. So if you're experiencing pain right now, haven't had a baby, thinking, okay, this is going to go away once I get everything stretched.
Maybe, but maybe not.
Yeah.
And if not, then know that you still can kind of seek help and get this thing fixed.
Yes.
Or not live with that forever, especially when it comes to something that's supposed to be so darn enjoyable.
Right. Absolutely.
At the beginning of the show, we were talking about some of the struggling with some of the reasons for struggling with intimacy. And one of the things you had mentioned that I was very, very curious about was deep thrusting. And you said, we'll go into the reason why that might be a little bit. Did we get into that?
No, we didn't.
Let's do that. I want to know.
So a lot of, like with the initial penetration, it could be at those more superficial muscles right at the entrance to the vaginal entrance. But pelvic floor muscles run from pubic bone back to the coccyx and the sacrum, and then fill that space between the sits bones. And so that's all pelvic floor muscles. So even if there's some stretchiness right at the front towards the pubic bone area, so to speak, there may be more tightness towards the backside.
That makes sense.
Some deep thrusting, we get into there, and then that might be where someone's experiencing some of the discomfort.
Could that have been caused? I'm just kind of like, why would that happen? So could that have been caused from like micro tearing internally on that area, like that deeper area, rather than the front part, or what is the cause of that?
Yeah, going back to what we just talked about. I mean, that open birth pattern, it's all connected. I think we tend to sometimes try to compartmentalize the body. Like, well, that's by the tailbone, so that's different than the pubic bone.
Right.
It's all connected.
Right.
Not only muscularly, but fascially. So the connective tissue covers every single cell of the body. So it might not even necessarily be a micro tear of the muscle or a tear of the muscle, okay? But it can be that some restriction and tightness into the connective tissue, okay? And we can't separate that out either. So going back to the same causes, no matter where those tissues are feeling and registering that pain, a lot of those causes can be the exact same, okay?
Okay. Are there any other things that we haven't mentioned that could still be causing problems? We actually covered a lot, but I'm just wanting to make sure that we hit them all.
One last thing is just other scars. So other types of surgeries that might have happened in the past. So think of abdominal surgeries or like a gallbladder needing to be taken. Yeah, so even that scar tissue. Again, everything's connected through the connective tissue. So even if sometimes things seem bizarre or like, how could that be connected? In our traditional Western medicine model of healthcare wants to compartmentalize a lot of things. Yeah. But quite honestly, I see that a lot when we look at the body, again, as a whole. So,
gosh, that's so tricky because I had my gallbladder removed. I actually had the liver surgery where they took the gallbladder, and I would have never, I don't think my brain would have put those two puzzle pieces together had it happened. I don't know that I would have just not related. But my guess is when somebody goes to you, they're going to you because, hey, you know what? I'm really having issues with sex. It's super uncomfortable. And you probably do a deep dive into their history to try to start to figure out where you're going to start. Is that right?
Absolutely. We have a pretty, I wouldn't say it's really long, but we have a thorough health history. There's a reason for that. It goes over a little bit of the mental, emotional things, like tell us your history or, just like check boxes. Do you experiencing any of these over the last month persistently? And sometimes people they don't know that things are connected. And so
Right,
it's a thorough assessment or a thorough questionnaire so that we can see that bigger picture, that they may not have the knowledge to be able to put things together. And there are times, that we talk to people before they come in. We do a consultation on the phone and talk to them, and then they come in, and there's still sometimes where I'll look at stuff and go, you know what, I got a question about this. Oh, you say you have migraines. Let's talk about that a little bit more. How long has that been going on? Or, I'll just notice something in their history because, again, everything's connected. So even if we're dealing with pelvic floor stuff, I'm looking at if they have had a head injury or if they've had something higher up, that we don't want to ignore that because it can be part of what's going on.
Interesting.
So, scars, surgeries, we want to know all of that stuff. It's not just an annoying thing to, gosh, I got to put this down again. It really does tell us information. I tell my patients, I'm going to look at you as a whole person. And you're not just your bladder. You're not just your vagina.
Right.
You're not, just your uterus.
A whole person and a whole story and a unique individual story, it sounds like, is, what is going to tell you what that person needs.
Absolutely.
This is like my big question when I'm thinking about all of this. All right.
Lay it on me.
How the heck are we fixing the pelvic floor? How what are you doing? I mean,
what am I doing?
Yeah, like, are you putting your hands inside a person?
I am. And I will tell you, if you want to ask me more, it took me a long time to be able to do this work. One, because I had my own pelvic issues and wounds that I needed to heal. And so this is not work for everybody.
Right,
It really isn't. But yes, we do go into the internally. So while we can do as much as we can externally into the lower abdomen, the low back, the hips, thighs, things like that, to get to the pelvic floor and do a better job, it's best if we go internally. So typically with that, we go into the vaginal space for women. But there are times where we do rectal work as well because we might need to go through the rectum to get closer to the coccyx to release that. So, yes, we were very professional and very therapeutic.
Right.
And we stay away from erectile tissue like the clitoris. That's
right.
We stay away from that unless there's a really big need to be working around the
in the case like the tear was starting to go up to the clitoris.
Absolutely.
I've seen that a couple of times in births. Oh gosh,
but it's pretty rare. But we stay down into that vaginal space, and it's very, like I said, very respectful and therapeutic. That's why we build trust with our patients and keep a safe space.
So if I am a person listening to this episode and I am actually having an issue, my first thought is, well, if I don't want my partner entering my vajayjay, I don't know that I want you entering my vajayjay. What could be their expectation as far as sensation and the pace of the therapy?
Yeah. The number one rule that I have, respect the tissues.
Yes.
So for one, my finger probably is a lot smaller than your partner's.
That's good to know. So it's not your whole hand.
Yeah, it's not my whole hand.
It's just a finger. Okay.
So so that's typically should be it's much smaller than a penis, right?
So causing that initial penetration pain, hopefully, right?
But that's why we start external. Part of it's building trust, but we know we can affect the vaginal tissues and the pelvic floor indirectly by addressing the pelvis, addressing the bony structure and the glutes, for instance, the gluteal muscles or the inner thigh muscles. We can already start to affect that and start to work with the body. Going back to the kidney release, for instance, that helps the nervous system to calm down so we don't have tension and kind of this fight or flight response going on into the pelvic floor area. So there's definitely a progression of what we do, and that's also why we do that, so that we don't have to cause more injury, more pain into a painful area.
Yeah. Or like, if we're in here because of trauma, or like, oh my gosh, I have trauma around this area, and then we're going to go and manipulate it. That sounds but it sounds like it's a nice, slow process, and
And if
gentle touch?
Very
like
gentle
a massage?
touch. Yeah, it's so I do a lot of myofascial release. We're always listening to the body with our touch. And so when the body invites us in, we go in. When it just we just meet it where it's at.
Nice.
Okay, so if it's tight, we wait right there and we give it patience and we just wait for it to soften and release. Then we might go in a little bit deeper into that pelvic floor area, but we always, again, respect those tissues. And I do want to reiterate, if you're listening to this and you have had some trauma and this is really scaring you, and where you know what, I need this work, but I'm scared. That's why we start external, and we always, talk to you about that and get that consent. And if you decide to never go internal, you don't have to. Okay, so we can still affect pelvic floor muscles. But we don't necessarily have to go there, especially if you're not ready. Okay.
That's so good to know. There's this is like such an interesting area, and it also, I'm so grateful that you do this and this is available, because I actually have worked with a lot of women who have had injuries to the pelvic floor due to birthing their baby. And you know what I've heard? They usually say they'll go to the doctor and they'll mention that this is uncomfortable and they're having a problem. And the doctors are typically telling them that the only way to fix it is surgery. That's like a massive difference from what you just described, which was, gentle touch and some, just manual touch with fingers versus very invasive. I mean, like the thought of having surgery there also does not sound awesome to me.
Yeah. Yeah, absolutely. That is like from one extreme to the other.
Right.
And there's times where I hear that too. And as a physical therapist, my first question is, what are they going to do surgery on?
Yeah.
What are they actually doing surgery on?
Right.
And surgery is not always the answer, and it shouldn't be the first answer. Trying
That's
something
exactly
conservatively,
it.
like what do you have to lose other than maybe a little bit of time, unless it's an emergency surgery.
Right.
When we're talking about pain with sex after having a baby, there's not an emergency there.
Right.
And so trying something conservatively should be the first line of treatment. Unfortunately, doctors don't know this. Like, not all doctors know this, or not all doctors recognize that, hey, the mind, the psyche, the energetic body also has to do with pain. And again, going back to our Western medicine, not always recognized like that. So I'm not saying it's woo-woo and that it's not valid, but, if that's...
It's just a different philosophy, right? They've been taught one thing, which is, here's the thing about Western medicine is it's very, like you mentioned a couple of times, it's very compartmentalized. I mean, there are people who are doctors who are specialists that specialize in like 3 inches of the body. And that's all they focus on, just that one piece, as if you could pull it out and throw it in a petri dish and kind of manipulate it that way. That's just their focus. So it's not a problem. It's fantastic when they can solve a problem that needs solving. But sometimes it's a little bit of a disconnected approach where maybe there are other things going on. And I'm 100% with you. I mean, my girlfriend recently hurt her knee, and the doctor... actually, I think maybe the insurance required that she go to PT before having surgery. And I feel like this is one of those cases where you're having pelvic floor issues, whether it's sex or whether it's incontinence or, constipation or any of those things. Seems to me you stop at the PT's office and do some work there and see what kind of progress you can make prior to going all in under the knife, right?
Yeah, absolutely. And every PT in this whole country would agree with you. I guarantee it. I don't care what specialty they're in. Absolutely. Our thing is getting people moving better and helping them. If I consider it a great day if I can help someone avoid surgery, if I can help them avoid, long-term medications and immobility and things like that, and improve their quality of life. Absolutely. You know. So it's, again, it should be the first treatment option.
Justine, it has been so great chatting with you, and thank you for letting me ask you all the funny questions. We shared a space for a little while, and I've always wondered all of these things. And I think it's perfect that it was you and I. Hannah actually worked with you, so she already knew how it worked. But I never experienced working with you, so I had no idea what this looked like. And I think they're kind of funny questions, but you just kind of want to know what this is, right?
Very common questions. Everything you've asked me today, I hear over and over. And I absolutely love what I do. I'm very passionate about it. So anybody that's willing to listen to me talk about pelvic floor physical therapy, thank you. I love it. Love talking about this.
So before we wrap it up today, we are located in Colorado Springs, Colorado. And so if any of our local listeners are listening and they're thinking, oh my gosh, I got to see Justine, how do they find you?
Best place is just to go to our website, healingspotpt.com. There's, pick your choice there on the best way to move forward. You can definitely give us a call, but there's also like a free discovery session that we have. So fill out a form on our website. It's on the homepage. We also have some free resources, so check those out. It's just under our resource tab, under free resources. So even if you're not local to Colorado Springs, go there, get some information. It might even give you a chance to ask better questions to your provider. Look for somebody that's going to listen to you and help you.
What are some of those free resources? I'm super curious.
Yeah, so there's one called A Complete Guide to Pelvic Floor Physical Therapy, Women's Edition. I think that's probably the most applicable. Go there. All you have to do is give in your email and your name, and you can get that resource and read it at your convenience. There's some other ones as well that you can check out related to bladder tips and bowel, like constipation guides. So,
fantastic.
Head there.
Fantastic. Justine, thank you so much for carving time out of your busy practice to come and chat with us. It's been so fun. It's been so good to see you again.
Too. Thank you. And I got to say, this is the same room that I rented from you that I saw patients in that were doing the podcast. So it's kind of fun to be back in here and to see you again. And I do so appreciate you inviting me on.
Well, thank you. And hopefully we'll get to have you back again, because I feel like there are definitely some topics that we still need to chat with people about, like pre-pregnancy, during pregnancy, right? There's so many good reasons to visit a woman's health PT. But until next time, thank you, listeners, for staying with us. If you haven't subscribed to the podcast yet, be sure to hit subscribe so that you get notifications when we release a new episode. And until next time, stay healthy.